Are you unknowingly making a medication mistake that could put your life at risk right now? In the next 15 minutes, I'll reveal 9 critical medication errors that doctors spot instantly in seniors, mistakes that could be happening in your medicine cabinet today. And mistake number 7, it's so common and so deadly that it claims thousands of senior lives every year, yet most people have no idea they're doing it. Beverly, a 72-year-old from Denver, thought she was being responsible by managing her medications carefully, but when she collapsed during her morning walk and ended up in the emergency room, her doctor immediately spotted 3 critical mistakes she'd been making for months. Today, you'll learn exactly what those mistakes were and how to avoid them. Mistake 1. Taking medications with the wrong beverages. Did you know that your morning coffee could turn your heart medication into a dangerous gamble? This seemingly innocent habit is one of the first things doctors check when seniors experience unexpected side effects or medication failures. Research from Johns Hopkins Medical Center shows that certain beverages can alter medication absorption by up to 40%, essentially turning your prescribed dose into either a dangerous overdose or a completely ineffective treatment. The problem isn't just with coffee, though that's a major culprit, but with any beverage that changes the pH levels in your stomach or interferes with how your body processes medications. Consider what happened to Frank, a 69-year-old retired teacher from Sacramento who religiously took his blood pressure medication every morning with his large cup of black coffee. After 3 months of perfect compliance, his blood pressure readings were still dangerously high, and his cardiologist was baffled. It wasn't until Frank mentioned his coffee routine that the mystery was solved. The caffeine and acids in coffee were preventing his body from properly absorbing the medication, leaving him essentially unprotected against stroke and heart attack. Within 2 weeks of switching to plain water, his blood pressure dropped to normal ranges. The solution is remarkably simple, yet most seniors never receive this crucial information from their healthcare providers. Always take your medications with a full glass of plain water, unless your doctor or pharmacist has given you specific instructions otherwise. Avoid coffee, tea, grapefruit juice, milk, and alcohol for at least 1 hour before and after taking any medication. This single change can mean the difference between your medications working as intended and putting your health at serious risk. Check what you're drinking with your medications right now. Your life could depend on making this simple adjustment today. Mistake 2. Storing medications in humid environments. Is your bathroom medicine cabinet slowly destroying your life-saving medications? This storage mistake is so common that pharmacists estimate over 70% of seniors are unknowingly rendering their medications less effective or even dangerous. The Mayo Clinic warns that humidity and temperature fluctuations break down medication compounds within weeks, transforming your carefully prescribed treatments into unpredictable substances that may not work when you need them most. Your bathroom, despite its convenience, creates the perfect storm of heat, moisture, and temperature changes that can destabilize even the most robust medications. The science behind this problem is both fascinating and terrifying. When medications are exposed to humidity levels above 60%, which is typical in most bathrooms, the active ingredients begin to deteriorate at an accelerated rate. This breakdown doesn't just make medications less effective, it can actually create new chemical compounds that may be harmful to your body. Temperature fluctuations from hot showers further accelerate this process, meaning that medication you took yesterday might be completely different from the same medication you'll take tomorrow. The expiration dates on your bottles become meaningless when storage conditions aren't optimal. Take the case of Linda, a 74-year-old from Miami who stored her diabetes medication in her bathroom cabinet for convenience. Despite taking her medication faithfully every day, her blood sugar levels began fluctuating wildly, and she started experiencing dangerous spikes that left her dizzy and confused. Her endocrinologist was puzzled until they discovered that the humid Florida climate, combined with her daily hot showers, had degraded her medication to the point where each pill contained unpredictable amounts of active ingredient. Once she moved her medications to a cool, dry bedroom drawer, her blood sugar stabilized within days. The fix requires immediate action but minimal effort. Store all medications in a cool, dry place away from bathrooms, kitchens, and anywhere temperatures fluctuate. A bedroom drawer, hall closet, or dedicated medication box in your living area works perfectly. Keep medications in their original containers with the silica gel packets intact, and never store them in cars, garages, or windowsills where temperature extremes can occur. Move your medications to proper storage today, because tomorrow's dose needs to be as effective as the day your pharmacist dispensed it. Mistake 3. Crushing or cutting extended-release pills. Are you accidentally creating a dangerous overdose every time you cut your pills? This mistake is particularly dangerous because it seems so logical and helpful, especially when pills are large or difficult to swallow. Harvard Medical School research shows this seemingly innocent practice causes over 10,000 hospitalizations annually among seniors, with many cases resulting in life-threatening complications. Extended-release and enteric-coated medications are specifically designed to release their contents slowly over time, and altering their structure can dump an entire day's worth of medication into your system at once. The engineering behind these medications is remarkably sophisticated. Extended-release pills use special coatings, matrices, or capsule designs that control exactly when and how much medication enters your bloodstream. When you crush, cut, or chew these pills, you're essentially breaking a carefully designed time lock that could release 12 or 24 hours worth of medication immediately. This sudden flood of active ingredients can overwhelm your system, causing dangerous side effects that range from severe nausea and dizziness to life-threatening drops in blood pressure or heart rhythm problems. Harold, an 81-year-old from Portland, had been cutting his extended-release blood pressure pills in half for months because they were difficult to swallow. One Tuesday morning, about an hour after taking his usual half pill, he experienced such a severe drop in blood pressure that he fainted and hit his head on his kitchen counter. The emergency room doctor immediately identified the cause when Harold's daughter mentioned his pill-cutting habit. The medication that should have worked gradually over 24 hours had hit his system all at once, creating a medical emergency that could have been fatal. Never alter any pill without explicit approval from your doctor or pharmacist. If you're having trouble swallowing large pills, ask your healthcare provider about liquid formulations, smaller dose options, or techniques for easier swallowing. Many medications that seem identical actually have different release mechanisms, so even if you've safely cut one type of pill before, never assume it's safe to cut others. Contact your pharmacist today if you've been altering any medications. They can provide immediate guidance and potentially life-saving alternatives. Mistake 4. Taking medications at inconsistent times. Could your irregular medication schedule be creating a medical time bomb? Time consistency in medication administration isn't just a helpful suggestion. It's a critical component of how medications work in your body. Studies from the American Medical Association show that timing errors increase side effects by 60%, while simultaneously reducing medication effectiveness, creating a dangerous double-edged problem that many seniors unknowingly face. Your body's internal systems operate on precise rhythms, and medications are designed to work within these natural cycles. The concept of medication timing goes far deeper than simple convenience or routine. Your liver processes medications differently at various times of day, your stomach acid levels fluctuate predictably, and your cardiovascular system has natural peaks and valleys that affect how drugs are absorbed and utilized. When you take medications at random times, you're essentially forcing your body to process these substances when it may not be optimally prepared to do so. This inconsistency can lead to periods where you're essentially unmedicated, followed by periods where medication levels are dangerously high. Consider Dorothy, a 66-year-old from Phoenix, who took her heart medication whenever she remembered, sometimes at breakfast, sometimes at dinner, and occasionally not until she was getting ready for bed. Over several months, she began experiencing increasingly frequent episodes of rapid heartbeat and chest pain. Her cardiologist discovered that the irregular timing was creating gaps in her medication coverage, followed by periods of medication overlap that were stressing her cardiovascular system. Within 2 weeks of establishing a consistent morning routine, her symptoms disappeared completely. Set daily alarms on your phone or watch for each medication, and use a weekly pill organizer with separate compartments for different times of day. Take medications at the same time every day, even on weekends and holidays. And if you miss a dose, follow the specific instructions your pharmacist provided, rather than doubling up or skipping entirely. Consistency in medication timing is as important as taking the medication itself, so establish your routine today and stick to it religiously. Mistake 5. Ignoring food and medication interactions. Is your healthy dinner secretly sabotaging your medications? Food and medication interactions represent one of the most overlooked aspects of senior healthcare, yet they're responsible for significant treatment failures and unexpected side effects. The CDC reports that food interactions cause 30% of medication-related emergency visits in seniors, with many of these cases involving foods that are generally considered healthy and beneficial. The timing of meals, the types of foods consumed, and even the amount of food in your stomach can dramatically alter how your medications work. Understanding food and medication interactions requires recognizing that your digestive system is essentially a complex chemical laboratory. Different foods change the pH levels in your stomach, alter the speed at which medications are absorbed, and can even chemically bind with medications to prevent them from working entirely. Some foods increase the absorption of certain medications to dangerous levels, while others create barriers that prevent medications from reaching your bloodstream at all. These interactions aren't just theoretical possibilities, they're measurable, predictable effects that can be managed with proper knowledge. Take the experience of Richard, a 73-year-old from Cleveland, who prided himself on eating large salads filled with leafy greens every day for his health. However, he couldn't understand why his blood-thinning medication seemed to be losing effectiveness, requiring constant dose adjustments that frustrated both him and his doctor. The breakthrough came when his pharmacist explained that vitamin K in leafy greens directly counteracts blood-thinning medication. Spacing his salads away from his medication times and keeping his intake consistent, Richard was able to stabilize his treatment without giving up his healthy eating habits. Ask your pharmacist for a complete food interaction list for every medication you take, including over-the-counter drugs and supplements. Pay particular attention to timing instructions that specify taking medications with food, on an empty stomach, or avoiding certain foods entirely. Keep a simple chart on your refrigerator that lists your medications and their food restrictions, and review this information whenever you plan meals or snacks. Don't let your next meal undermine your medical treatment. Get this critical information from your healthcare team today. Mistake 6. Using expired medications. Could that slightly expired medication in your cabinet be slowly poisoning you? The expiration date on your medication bottles isn't just a suggestion or a way for pharmaceutical companies to sell more drugs. It represents the last day that the manufacturer can guarantee the medication's safety and effectiveness. Research from Johns Hopkins shows that expired medications don't just lose potency over time. They can actually develop toxic compounds that may harm your organs, particularly your kidneys and liver. What seems like a minor cost-saving measure or convenience could be putting your health at serious risk. The chemistry of medication degradation is complex and often unpredictable. While some medications simply lose effectiveness after their expiration date, others break down into harmful substances that your body must work to eliminate. This breakdown process is accelerated by heat, humidity, and light exposure, meaning that expired medications stored in less than ideal conditions may be even more dangerous than their expiration date suggests. Additionally, the preservatives and stabilizers in medications also expire, potentially allowing bacterial growth in liquid medications or chemical changes in pills and capsules. Consider what happened to Joyce, a 78-year-old from Tampa who had been using expired antibiotic eye drops for a minor infection because she wanted to avoid the cost and inconvenience of a doctor visit. Instead of clearing up the infection, her condition worsened significantly over several days, and she developed additional symptoms that required emergency treatment. The expired drops had not only lost their effectiveness against the original infection, they had also introduced harmful bacteria that created a secondary infection requiring intensive antibiotic treatment and nearly causing permanent vision damage. Check expiration dates on all medications monthly and dispose of expired medications safely at pharmacy drop-off locations or community disposal events. Never flush medications down the toilet or throw them in regular trash where children or pets might access them. Replace expired medications promptly, and don't try to stretch the use of medications beyond their expiration dates, even if they seem fine. Clean out your medicine storage area this weekend because using expired medications is never worth the health risks involved. Mistake 7. Mixing over-the-counter drugs with prescriptions. This innocent mistake kills over 3,000 seniors every year, and you might be next without even realizing it. The Mayo Clinic identifies the dangerous mixing of over-the-counter medications with prescription drugs as the leading cause of accidental overdoses in adults over 60, yet most seniors have no idea they're creating potentially lethal combinations in their own medicine cabinets. The problem stems from the common misconception that over-the-counter medications are inherently safe simply because they don't require a prescription. In reality, these medications contain powerful active ingredients that can interact catastrophically with prescription drugs. The danger lies in the fact that many over-the-counter medications contain the same active ingredients as prescription drugs, or ingredients that amplify the effects of prescription medications to dangerous levels. Pain relievers, sleep aids, allergy medications, and even vitamin supplements can create serious complications when combined with prescription drugs. Blood-thinning effects can be multiplied to the point of causing internal bleeding. Blood pressure medications can be enhanced to cause dangerous drops, and liver processing pathways can become overwhelmed when too many medications compete for the same metabolic resources. The tragic case of William, a 71-year-old from Seattle, illustrates this danger perfectly. He had been taking a prescription blood thinner for several months when he developed a headache and took an over-the-counter pain reliever that he'd used safely for years. Within hours, he began experiencing severe stomach pain and vomiting blood, symptoms of internal bleeding caused by the combination of his prescription blood thinner and the aspirin in the over-the-counter pain medication. Emergency surgery was required to stop the bleeding, and William spent 2 weeks in intensive care, recovering from what should have been a simple headache remedy. Create a complete list of everything you take, including vitamins, supplements, herbal remedies, and over-the-counter medications, and show this list to your doctor and pharmacist before adding anything new. Never assume that over-the-counter means safe to combine with your prescriptions, and always ask your pharmacist before taking any new medication, even for minor symptoms like headaches or allergy. Keep an updated medication list in your wallet and share it with every healthcare provider you see. Make that comprehensive list right now, because your life literally depends on your healthcare team having complete information. Mistake 8. Stopping medications without medical supervision. Why do doctors panic when you suddenly stop taking your medications? The human body develops dependencies on many medications that go far beyond addiction or habit, creating physiological adaptations that can be life-threatening if disrupted suddenly. Harvard Medical School studies show that abrupt medication cessation causes 40% of senior medical emergencies, with many of these cases involving medications that patients assumed were safe to stop because they were feeling better. Your body often adjusts to medications in ways that make sudden discontinuation dangerous, even when the original problem seems resolved. The concept of rebound effects is crucial to understanding why stopping medications can be so dangerous. When you take certain medications regularly, your body compensates by adjusting its natural production of hormones, neurotransmitters, and other essential substances. If you suddenly remove the medication, your body may not be able to readjust quickly enough, creating a dangerous gap where you're essentially unprotected. This is particularly dangerous with heart medications, blood pressure drugs, and seizure medication, where sudden cessation can trigger life-threatening complications within hours or days. The experience of Thomas, 68-year-old from Dallas, demonstrates how dangerous this mistake can be. After taking blood pressure medication for 2 years, Thomas felt great and decided he no longer needed the pills, so he simply stopped taking them without consulting his doctor. 3 days later, he experienced what doctors call rebound hypertension, with blood pressure readings so high that he suffered a mild stroke that affected his speech and mobility. His doctor explained that his body had become dependent on the medication to maintain normal blood pressure, and stopping suddenly had caused a dangerous rebound effect that could have been prevented with gradual dose reduction under medical supervision. Never stop taking any medication without consulting your doctor first, even if you feel completely better or think the medication isn't helping. If you're concerned about side effects or want to reduce your medications, schedule an appointment to discuss your options rather than making changes on your own. Many medications require gradual tapering to avoid dangerous withdrawal effects, and your doctor can create a safe plan for any changes you want to make. Contact your healthcare provider today if you've recently stopped any medications without medical guidance, because some rebound effects can be delayed and still dangerous. Mistake 9, not updating all healthcare providers about medications. Could your specialist unknowingly prescribe something that conflicts with your other medications? In today's healthcare system, many seniors see multiple doctors for different conditions, and the lack of communication between these providers creates dangerous opportunities for medication conflicts. The American Medical Association reports that medication conflicts cause 15% of preventable hospitalizations, with the majority of these cases involving seniors who see multiple specialists who aren't aware of all the medications being prescribed by other doctors. Each doctor may be prescribing appropriately for their specific area of expertise, but the combination of treatments can create serious problems. The complexity of modern medicine means that even the most knowledgeable doctors can't possibly remember every potential interaction between the thousands of available medications. Electronic health records help, but they're only as good as the information entered into them, and many healthcare systems don't share information effectively between different practices, hospitals, and specialists. This means that your cardiologist may not know about the arthritis medication your rheumatologist prescribed, and your dermatologist may not be aware of the blood thinner your primary care doctor manages. Without complete information, each doctor is essentially working blind to potential interactions. Consider the dangerous situation that developed for Nancy, 75-year-old from Atlanta, who was seeing a cardiologist for heart problems and an orthopedic surgeon for knee issues. Her cardiologist had prescribed a blood thinner to prevent clots, while her orthopedic surgeon prescribed an anti-inflammatory medication for post-surgical pain management. Neither doctor was fully aware of what the other had prescribed, and the combination created a bleeding risk so severe that Nancy required emergency surgery to stop internal bleeding that had developed gradually over several days. The interaction was predictable and preventable, but only if both doctors had complete medication information. Carry a complete updated list of all your medications to every doctor appointment, including dosages, frequencies, and prescribing doctors. Update this list immediately whenever any changes are made, and make sure every healthcare provider you see has a current copy. Ask each doctor to review your complete medication list before prescribing anything new, and don't assume they have access to information from your other doctors. Create or update your comprehensive medication list today, and make sure every member of your healthcare team has current information that could prevent dangerous interactions. These 9 mistakes might seem small, but they have enormous consequences for seniors. The good news is that every single one is completely preventable with simple actions you can take today. Remember Beverly from our opening story? She implemented these exact changes and hasn't had a medication-related problem since. You have the power to protect yourself right now by making these critical adjustments to how you handle your medications. If this video helped you spot a mistake you've been making, hit that like button and tell me in the comments which mistake surprised you most. Subscribe for more life-saving health tips, and please share this with other seniors in your life because you could literally save someone's life today. Which of these mistakes have you been making? Let me know below and take action on what you've learned right now.